Today we're moving to this notion of a collaborative engagement. And I think the ability to collaborate with various stakeholders is at the essence of what's going on in the world today in clinical medicine. We're at an inflection point. Because I think it's fair to say that the processing of information, the electronic medical record, is in many ways the linchpin to success of so many of our initiatives.
So recent data identifies that over half of US physicians are currently experiencing signs of burnout, and that rates of burnout are increasing dramatically. In fact, in just the last 3 years, the rates have increased from 46% to 54%, a 9% absolute increase in that short period of time. The major driver of physician satisfaction is quality of care, the feeling at the end of the day that you had done your best for your patient. And what was the major driver of physician career dissatisfaction? As a complete surprise to the investigators, it was the electronic health record. And how could this be? How could this tool that has so much promise to be such a powerful intervention, how could it be the driver of dissatisfaction? Well, the reasons were, first of all, too much time for task. It simply takes too long. Second, a decrease in the amount of face-to-face time with our patients. And third, a degradation in the quality of the clinical documentation.
So I would say that EMRs are kind of like having a television set with no plugs on the back. We can get broadcast TV, but we can't really interact with it any other way. We can't plug in Netflix, we can't see cable, we can't play video games. We can't do all these other things that would make this TV more valuable to us. We're just sort of stuck with this baseline functionality, and that's what these EMRs are like today. We have some baseline functionality, but it's really challenging to build on top of it.
Healthcare is not a small industry. We have nearly 1/5 of every dollar produced in our economy flows through healthcare. We are taking close to 1/5 of the United States economy and trying to digitize its management of clinical information in less than 10 years. The Meaningful Use program, I would assert, tried to do too much. It tried to boil the ocean. It attempted in many ways to redesign the entire healthcare experience through the lens of one tool.
The EMR marketplaces are kind of like a toll road. You can drive on it a lot easier, but it costs a lot more, and only cars can drive on it, not trucks.
It's not the technology. It's the technology's usability and integration into the care system that is the problem that you and I need to solve together. We're really not paying that much attention to the patients and the system that they live in. We need to redesign the electronic health record and the care system in which it sits.
So one of the things that we need to think about is how do we reduce the cost of the whole system? Let's stop putting the burden on the physician, but think about reducing the cost. So maybe instead of 20 patients a day, a physician could only see 15 because they don't have as many FTEs that they have to support. So we have kiosk registration. We don't have a receptionist. And guess what? Patients can register. People can use ATMs. They can use kiosks to register themselves. So thinking about bringing the patient into the workflow so that we can reduce the costs.
Now, I know people think we want to design the whole healthcare information network of the future, but for right now and for the foreseeable future, we have real human beings delivering the care. And so it doesn't all have to be machine readable.
I think we're all beginning to understand as technologists now that you just can't give patients this technology. It's not all about the technology. There needs to be a connection and a relationship with their healthcare provider. And that's really where I think things are going. And what I'm talking about here is really looking at combining artfully the worlds of clinical health and the worlds of consumer health and fundamentally changing the relationship between patients and their healthcare providers in a way that empowers patients to take the maximum control of their health, but with the social and the medical support of their clinical providers.
Telehealth. So we've done some fun things in telehealth, and we saw 15,000 patients this way. We thought it was going to be young millennials who wanted to do this. Our oldest patient was 82 years old. There was no difference in acceptance rate of telehealth based on age or gender. Looked exactly like our normal patients. 95% of patients said it was as good, if not better, than traditional health care. And a full 34% said it was better.
We have put EHRs at the epicenter of all this. Now, I think we've done it to our disadvantage because we have now designed a very serious central failure point in the health system. So in a hospital, everything runs in and out through that EHR. So if it goes off, if it goes offline, the whole thing is brought to a halt. Now imagine this. If you were flying an airplane, if you were flying a jumbo jet and you're over the middle of the Pacific and all the avionics went black for 60 seconds, so the pilots were flying in the dark and no one got hurt and it landed safely on the other side of the ocean, would that plane not be grounded immediately? And how long would it stay down? Until they were certain they had found the problem. Every day in the United States, clinicians are using electronic health records that have all sorts of gaps and gaps in them, and yet we continue to fly with them all the time. We are flying the plane while we're building it at the same time, and that's a big problem.
85% of the Millennial Generation say that if they cannot communicate with their physicians and they do not feel that their physicians are listening to them and including them in their care, they'll walk.
If we dismiss this as a generational issue, we miss the problem. The group that I visited that was the most adamant about the shortcomings of their EHR were a group of residents, and they saw the difference between using Venmo and everything else they use on their smartphone and their EHR. And so they more acutely felt this gap between what was possible in their civilian life and what was happening in their medical careers. So I would say that the millennials might be pushing us to get better technology because the existing technology is so unsatisfactory.
Patients should always have access to their data. They should always be able to know their test results, their lab results. They should have access to this information. It's their health. They need to be engaged. Informed patients will do better for themselves. They'll do better overall. That is not the same thing as ownership. I own the data that I curate because I require that to comply with laws and regulations and be held accountable. That is different than a patient having access to the data that is generated about them and then owning their own curated data set. But this ownership terminology, I think, has not done us a service. Ownership and access are not the same thing, and what people own, it's very important to be precise about what's being owned.